Chapter 9, The Atlas, the fifth way your back breaks. Aaron, a highly skilled Marine, came to me with a pretty funky issue. A specimen of warfare, he stands 6'2" and weighs 225 pounds. During our consultation, he was complaining of a pain that he couldn't really put into words. It was in the left side of his neck and traveled onto his chest. He had a hard time taking a deep breath, and he would get lightheaded frequently as well. A secondary problem was his back pain. It would go out whenever it felt like it, he said, and it was very frustrating considering he ran 6 miles a day with a 60-pound backpack on. That's 60. During our first session, I had him work extensively on his left side neck, his left shoulder, and his left chest muscle. When he returned, he said it was better, but not completely gone. This went on for 2 more sessions, which frustrated me to no end because if my clients are not getting better, that means I'm off the mark. Since his body was telling me to look elsewhere, that is exactly what I did. I had Aaron dig into a reflexive point in his shoulder for his atlas bone, and what ensued was pure muscle geek comedy. First, the pain shot across into his left shoulder, then down into his left chest, then back up across to his right shoulder, down his right arm, and then into his right side upper back before diminishing with a slight popping feeling. How do I know all of this? Because he literally gave me a play-by-play as it was all going on. Aaron was amazed and could not believe what he had just experienced. I just smiled at the wonderment of how the body works. We then went on to loosen the lower back muscles as well as the hip and the leg on the left side. When Aaron returned for his last appointment, he said that the pain was down to about 5% and getting better every day. This case was special to me because Aaron was set to train for 7 weeks for Marine Special Operations Command, which is known as MARSOC. So I had a time crunch going on as I could not let him endure more pain than he was already experiencing. To my delight, he completed the training and was accepted into his new role in the Marines. Semper Fi, hoorah. All this time, through the entire book up until this point, I've been giving you little pieces of what creates most of the back pain people experience in their lives. Now in this chapter, we are going to put it all together. If I started with this chapter, about 99% of my readers would have put the book down and never picked it up again. By now, you've done 90% of the work you need to get better. The information in this chapter is now going to reset the entire fascial net, so the mobility work you do moving forward is going to be more efficient and more permanent. Let's get started. Just as a little preface, this right here can also be helped by a chiropractor impermanently, okay? I've gone to chiropractors where they say that they are adjusting the atlas bone. They are not, okay? In order to truly adjust the atlas bone, you have to go to a atlas-specific chiropractor, search for them in your area. Going to the atlas-specific chiropractor, they're going to use a big machine with a little metal handle. And what they're going to do is they're going to take images of your head and neck to see how and where the atlas is misaligned. And what this little machine is going to do, it's going to go ping, 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 and tap on that atlas bone until it is in its proper position. Okay. This is not a bone that you can crack or adjust using the hands. All right. So you need to go to an atlas specific chiropractor in order to get it done. And then I know I said this many times, never to rest. You probably have to rest for about 2 to 3 days after to make sure everything heals and that the inconsistencies in the angles of pull in the fascia and the muscle, okay, crossing these joints in the cervical region of the neck, don't get irritated and fire from muscle memory again, pulling the atlas back into misalignment. All right. One of the only times I highly recommend not moving after getting something done. All right. But here we go. The bone. If you read a copy of my book, The Foot and Ankle Pain Bible, you might have noticed a little cliffhanger. I talk about one of my mentors, Ida Rolf, and how she coined the saying, all problems start with the feet. Well, in some cases, that may be true. In my opinion, our true foundation is the atlas, not our feet. When you talk about what a foundation really is, being a base of support, then the foot seems to fit that fairly well. The problem to me is that the body is always going to follow the head as far as movement is concerned. If the head is off, the feet are going to be off, but the inverse is not true. Our feet can be off, but our head can be straight. If there is one thing that I see destroying more and more people's ability to function, it's an offset atlas. Your atlas is your first cervical vertebrae upon which your skull sits. So you have your head, and then you have your first cervical vertebrae. That is the foundation. Okay, the atlanto-occipital joint is what is in between. This area, these two players right here, are going to dictate the type of compression that your brainstem is experiencing. Now, science wants to show us that we have 10,000 nerves, right? Spoiler alert, we have just one nerve, and it starts at the brainstem, goes into the spinal cord, and then it extends via nerves out to the rest of the body. If we compress something right where the signal is coming out from the brain and going in, okay, the rest of the system is going to be kablooey. The most crooked people I've ever worked on, this is from an alignment standpoint, the most crooked people I've ever worked on have the worst atlanto-occipital imbalances, okay? The bone just below your atlas is called your axis. So you have your skull, your atlas, and then your axis. Tunneling down the middle of both of these vertebrae is your brainstem, which not only controls but also coordinates virtually all of your body's functions. When damage occurs to either of these two vertebrae, the connective tissue or muscles surrounding the bones, the atlas and the axis can misalign and lock into a stressed abnormal position. As a result of the abnormal pressure, tension, and irritation, there will be a disruption of the blood flow as well as cerebrospinal fluid circulating in this area. You are basically choking off the signals your brain is sending to the rest of your body from the launching point. Total body chaos ensues, creating pain in some cases from head to toe, but we'll be focused primarily where you move from the lower back. So here it is, right there. Okay. If we're tilted, look at that. You're walking, you're moving every day, and your head is like that. What ends up happening? Your body draws in tissue on that left-hand side. Now my head is straight, but I'm uber crooked. Okay. Definitely not anti-fragile. The most critical aspect of this injury is to note that an atlas subluxation will remain stuck in this abnormal position, slowly causing health problems over time, with the average time to onset of symptoms being 10 to 15 years. Here is a laundry list of health problems this simple misalignment can create according to the upper cervical health center. 1. Neck pain, stiffness, muscle ache. 2. Headaches that frequently involve the base of the skull and radiate usually to one side of the head. 3. Migraines that not only produce a throbbing pain but may cause visual disturbance, nausea, or vomiting. 4. Vertigo, dizziness, faintness, ringing in the ears, tinnitus, and some types of hearing loss. 5. Facial pain or palsy. 6. Grating or cracking sounds at the base of the skull when turning your head. 7. Inability to fully turn or lean your head to one side or the other. Loss of range of motion. 8. Shoulder pain that is commonly between the shoulder blades but can occur between the neck and shoulder area as well. 9. jaw pain that is typically behind the jaw or close to the ear. 10. Postural distortion. A. Head tilt. B. Shoulder tilt. C. Pelvic tilt. D. Short leg. E. Head, shoulder, rib cage, and pelvic rotation can also occur. 11. Chest or rib ache, discomfort, or pain from postural distortion. 12. Nerve root irritation can occur at the resulting stress points along the spine. 13. Radiating arm pain, shoulder pain, and leg pain, sciatica, can develop through nerve root tension and irritation. 14. Low back pain and spinal disc damage occur over time due to postural distortion. 15. Hip, knee, or ankle pain and dysfunctional, typically on the side of the short leg. 16. Brain congestion due to the mechanical blockage of blood flow, particularly venous drainage and cerebrospinal fluid circulation. Current research is pointing to neurodegenerative disorders developing over time due to long-term brain congestion. 17. High blood pressure, neurologically based. 18. Vagus nerve disruption presented as heart, lung, stomach, digestive, and bowel disorders. 19. An imbalance between sympathetic fight or flight system and parasympathetic rest and digest system, nervous system, which most commonly results in overactivity of the fight or flight response, leading to a chronic stress state. 20. Difficulty sleeping, insomnia, and in some cases, grinding of their teeth at night. 21. Numbness and tingling in all extremities. 22. Inability to take a deep breath, locked up breathing. 23. Postural orthostatic tachycardia syndrome, which is all of those problems, okay, and symptoms that we just read. That's a pretty long list of health problems a funky atlas can cause, wouldn't you say? Symptom number 23 is actually my own addition to the list. POTS is receiving a lot of buzz in the news lately, but if you look at the symptoms of POTS and compare them to a misaligned atlas, they are nearly identical. Here are just a few examples of symptoms people with POTS experience: blurred vision, lightheadedness, dizziness, and fainting, heart palpitations, headache, poor concentration, tiredness, gastrointestinal symptoms, for example, nausea, cramps, bloating, constipation, diarrhea, shortness of breath, head, neck, or chest discomfort, weakness, sleep disorders, difficulty exercising, anxiety, coldness, or pain in the extremities. When we dive deeper and look at the causes of POTS, nearly every website states that the causes of this condition are poorly understood. Causes of POTS are listed as starting after major surgery, being invasive, sets off alarm bells in the body, causing the brain to lock down muscle groups and protect joints. Pregnancy, carrying a weighted load, the baby for 9+ months, strain the delivery, or C-sections can stress the spine, head, neck, and shoulders. Trauma, a car accident or hard fall can jar the skull, locking the atlas in a poor position. 4. Viral illness. Laying in bed for days on end in poor positions will definitely lock up the atlas. How many times have you woken up with a stiff neck? So, something that I did not put in this book because I didn't have the information at the time: a blocked gallbladder meridian, or a hyperactive gallbladder meridian on my right side, can pull my head down into this dysfunctional arrangement, pinching the brainstem, creating those problems as well. How do I know that? Because I fixed my own. Okay. Now, for years of playing contact sports, training, having daddy issues, getting my aggression out, okay, through sports like football and weightlifting and hard things like marathons, triathlons, Brazilian jiu-jitsu, Olympic weightlifting, and then CrossFit, doing handstand push-ups, accelerated this condition. And what I ended up realizing was I didn't have POTS. I did have a crooked atlas, but it was because of how tight my gallbladder meridian had made this entire line of my body. Okay. And how did I find out that it was my gallbladder meridian? I started to have troubles digesting fats, which I never had before in my life. Okay, so once that hit, I was like, okay, what's really going on here? And I started following the pain points and ended up figuring it out. All I see when I read that list of fascial remodeling at its finest. During some of my lectures, I ask people to raise their hand if if they have experienced or are experiencing one of those symptoms. I usually get a 99% response in the affirmative. When I was younger, I used to get car sick, air sick, and seasick really bad. It subsided as I got older, but then I started having problems with my muscles and joints by the age of 14. By the age of 22, I wrecked my back doing a deadlift, and by the time I was 32, I blew out my right knee. While I didn't understand what was going on with me, I accepted the consequences because I did lead an above average life of activity. I was destroying myself on a daily basis with running, weightlifting, and cycling. It wasn't until I fixed my atlas that the body aches and pain, as well as my motion sickness, disappeared. Now that we have a grip on the situation, let's get to fixing yours. The muscles. Most people will find out that their atlas is offset primarily through visiting the chiropractor. The chiropractor will attempt to adjust it while very rarely achieving success. If the atlas does adjust, you can guarantee it will be maladjusted the very next day. This is because if you attempt to adjust the actual atlas vertebrae without relaxing the muscles surrounding it, the muscles will pull it back out of alignment through your normal functioning and body movements. When the atlas tilts, the small muscles surrounding it spasm and lock in order to stabilize the area. These are the muscles we are dealing with: obliquus capitis superior, rectus capitis posterior major, obliquus capitis inferior, intertransversarii cervicis. Don't forget those. I'm going to test you on them later. Let's not forget that there are two sides to your neck, meaning 8 very small, very strong muscles are spasming to lock down your skull, atlas, and axis. Having a chiropractor trying to adjust your atlas without first loosening up the surrounding tissue is like trying to open a door with a bazooka when it would be smarter to knock first. As you will see later, we actually get the muscles to straighten the atlas gently without the need for any popping or cracking. So far, we have 3 really serious problems. The first being our atlas is offset, compressing our brainstem. The second problem we have is that our very small, strong posterior neck muscles have gotten really tight, locking the area down. The third problem is the fact that all of this tightness compresses not only the brainstem, but nerves and the arteries that are surrounding and nourishing the area as well. When the atlas tilts and the head is crooked, the brain will make an autocorrection at the hips. This shifting of the hips will then make your head level at the cost of throwing your body into complete misalignment. Here is what the body looks like as this problem runs its course, turning into a literal pretzel. Okay, so you can Google this and you're going to see it very, very clearly. All right, but essentially what ends up happening is we get a misalignment. Let's say the right side gets pinched and pulled this way. And like I showed you, what your body does is it draws tissue up all on that left hand side. So now our head is straight. Okay. Even though the head is crooked, the head is straight. Now the body is crooked. Okay. No one ever sees it coming. I sure didn't. This is a classic example of fascial remodeling, or the idea of the body being entirely connected. Rather than allow you to walk around with your head crooked, your brain contorts the rest of your body to make you feel abandoned, make you feel balanced. You now function in dysfunction until your parts start wearing out. Shoulder pain here, knee pain there, back killing you every day, neck is stiff this day, then better the next. If you're an athlete, you can run into some serious trouble, and it may even be a career ender. If you're a stay-at-home mom, you'll just be wondering why you are feeling so old at such a young age. If you look at the bottom of the previous picture, you will see that it states the end result of your atlas being off is a short leg. During my initial consultation, the first thing I do is measure my client's feet, and 9 out of 10 times I find a short leg indicating a tilted offset axis. When I show them how one foot is shorter than the other, They always remark, "Yes, I know my chiropractor told me." I then ask if they tried to fix it, and they always say, yes, they tried. This is proof once again that you cannot permanently fix a short leg through adjusting the spine, as it is the fascia that holds our structure, not bone. The short leg is a symptom of a misaligned atlas bone. You don't cure a cold by treating a cough. To fix the short leg, you must fix the atlas, but you must also relax the muscles on the tight side and then relax the muscles on the stretched anchor side. If you have this issue going on, it can take years to correct by yourself if it's bad enough. If you think this may be you, I encourage you to contact me for a consultation. Many of my readers already have come to see me at my home in South Florida to kickstart this correction, as it is very difficult to do by yourself. I have one gentleman that is coming in to see me in November, actually, for this very problem. All right, fixing the problem. I realize that the information I just presented may be a bit daunting. As far as I know, what I just showed you and what I'm going to show you to release it is not being taught anywhere else on the planet today. This is a condition that needs to be studied, not just read about. Go get your thinking cap and let's get started. Fixing the atlas is simple. If I were to do it for you, I can typically align someone's atlas in as little as 5 minutes. I have worked on the area in question and the problem for up to 45 minutes, though. It was a really bad case. For you to do it manually, it is going to require a little bit more time and patience. You'll need to get a back buddy, which is a mobility tool for the head, neck, and upper back area. You can order one by going to my website, www.chriskadowski.com. You can also get it on Amazon. Just search back buddy. Okay, pretty simple. There is a reflexive point for the atlas right where your trapezius muscle meets your shoulder bone. By reflex, I mean exactly what you're thinking. If I tap the front of your knee extends without you actively contracting your quadricep. By pressing into this reflex, you will be releasing the small muscles surrounding your atlas, which is going to set off a chain reaction as your entire fascial net starts to relax. This is the key here. We are taught muscles are holding our positions. This is baby talk. We dismantled in the fascia section. By releasing the atlas reflex point, you unpretzel fry your body. You actually get this tension to release. The major mechanism holding the imbalance is turned off, allowing for the mobility work you do moving forward to become permanent. The day I realized this was when my practice exploded, and not only my life, but my clients' lives changed forever. While exhilarating, I am going to reiterate again. This is a lengthy process doing it by yourself. If you're in as much pain and frustration as I think you are, you owe it to yourself to never give up. Where my finger is pointing to is the reflex for the atlas. When pressure is applied, some people feel pain in that area only. Some people feel a buzzing in the lower back, and for others, I've had a crack or a pop occur. Here is that reflexive point right there in the trap. Why this thing exists is beyond me, and I stumbled upon it by pure accidente. Okay, for all my Spanish friends out there, pure accident. I stumbled upon it, and the first time I pressed in there, I watched this guy just metamorphosize in front of me. He stood up, walking around. I'm like, dude, you're straighter. And he's like, I feel straighter. My back pain has been reduced like 70%. Blew my mind. Okay. Whatever happens, just know that your body is correcting itself. You are merely giving it a tool to do so. Using the correct knob on the back buddy in proper positioning is very important. You want to use the pointy one on the side that has a larger loop. Like I said, this can be kind of tricky, but you will know when you hit the right spot because it will do 3 things. Be very tender, open up Pandora's box in your neck, and send a tingling into the back of your head, sensations into your back leg, or popping and cracking into the shoulder. Please note, some people do not experience any of those things, and some people experience more. If I were to say the atlas were an enigma, that would be very kind of me. To start the adjustment, you have to hook the back buddy behind your back, placing the knob in the area I showed you previously. From that position, you are going to pull down with the arm opposite the knob and lean forward, placing as much pressure on that reflex as you can. Weird, I know. As far as I can find, there is no other documentation showing how to release the atlas reflex manually by yourself. In fact, I can't find anyone talking about the atlas reflex online except one other person right now, and the way he shows how to release it is very elementary, but at least he's on the right track. Typically, you need to put pressure on the atlas reflex for around 1 minute per side. Doing each side 4 or 5 times per day should be enough to start. If you're not feeling what I'm describing, keep searching around in the area I reference, and I promise you'll find it. I've coached many people through the computer even to find their atlas reflex point. All it takes is a little determination, a lot of pressure. Do not give up. Keep trying. The mysteriously elevated shoulder. After applying pressure to your atlas reflex, I want you to look for a raised shoulder. If you look at it yourself in the mirror, this is what you should see. It's basically like this. Whatever side is elevated to the short side of your neck, the long side of the rest of your body needs to be released so your opposite side hip can drop down and relax. To do this, you are going to sit down on a large loop in the back buddy on your opposite leg and place the small knob of the loop on your trap muscle. From there, rather than having to pull down quite hard and tire your arm out, you can just posture up to place sufficient pressure on your trap muscle. This muscle is tough, and you'll want to spend around 4 to 6 minutes penetrating the tissue to get it loose. Look for anything tender, tight, or sore. Please note that the shoulder will not drop overnight. You will probably need a month or two of working on it at least 3 times a week, depending on how badly elevated your shoulder is, till you start to see the results. An extremely elevated shoulder like the one I show in the picture is one tough cookie. Be patient. Last but not least, remember those small little muscles I was talking about earlier, obliquus capitis superior and friends? Well, these guys need some serious love now that we took the tourniquet off your atlas and with the last 2 mobilizations that we did. There are 2 ways you can grind these guys out, the nice way or the easy way. The nice way. To massage these guys the nice way, you'll want to use the 2 side-by-side knobs on the large loop of the back buddy. Put a little lotion on the back of your neck before you start, and then put both knobs on the back of your neck and slide them up and down, applying as much pressure as you need to get a response. I like to spend about 1 to 2 minutes gliding both of those knobs up and down my entire neck. In some instances, I will pin the tissue down in my neck and turn my head a couple of times to tear apart and unlock the small muscles that may be stuck. The easy way. The easy way is a bit more intense because the circumference of the knob is a lot smaller, allowing for deeper penetration. To do this mobilization, you are going to use the smallest knob on the shaft and grind into those small neck muscles right alongside your spine. Make sure you put lotion on your skin again. This technique is going to take a little longer, but not by much because I am going to make you do each side for 2 minutes. Simply glide the little knob up and down, searching for tender or sore tissue. Please be careful if your neck is really tight and you have never used anything to massage it before. This can be quite painful. Surprisingly, that is it for the atlas. Now that you have started to get the atlas back in its home, the rest of the body will start shifting in your favor, moving back to true alignment. Working on the muscles of your back and hips will now be easier and more productive. Opening the atlas is a behemoth. I've had a lot of people experience a lot of interesting things with this mobilization. Numbness and tingling in the extremities, fatigue, dizziness, nausea, on and off headaches, and difficulty sleeping. The benefits greatly outweigh all of the trouble, though, as your body starts to unwind itself and the small aches and pains start to subside. The big aches and pains are going to require a little more attention. The good news is that if you have been doing everything I wrote about already, there's nothing new. let's assume your right shoulder is elevated. Here is the program you have to focus on moving forward. 1. Release the right atlas reflex. 2. Release right trapezius muscle. 3. Work on the superficial back line from the right rhomboid to the right hip. 4. Work the superficial back line from the left lower back down to the left foot. Here is your continuum if your left shoulder is elevated. Release left atlas reflex. Release left trapezius muscle. Work the superficial back line from the left rhomboid to the left hip. Work the superficial back line from the right lower back down to the right foot. Concluding thoughts. The goal of this program is to get 1 to 3% better every month. Read that again, please. If you have an atlas issue, there is no quick fix except for coming to see me. Like I mentioned before, many people do that once we've identified this is the issue they have. They then do all of the other work themselves back at their respective homes. I wish that just releasing the atlas was the end of it, but it is not. The body still needs help releasing that static contractions being held by the fascia downstream. If you have an atlas issue, using this program to get better is now your new full-time job. Many people succumb to the promises of Western medicine, the pill shot surgery paradigm with promises of a full, quick, pain-free recovery. Most of the time, this is not the case, mainly because someone else is doing the work for you. Here, with this knowledge, you are in charge. You can only blame yourself when you don't do the work. Subconsciously, that scares people, and before you knew it, you quit before you even got started. Don't be that person. As a parting gift, allow me to give you some real-world examples of how quickly an atlas issue can develop even in your youth. As a result of leaning on the short leg day after day, walking, running, squatting, jumping, etc., the force one generates creates a buildup of tissue along the lines it travels through. This gentleman had a short leg and a raised left shoulder. You can see how his spinal erectors on the left side are compensating for the increased workload. This lady came to me with incredible back pain. Left leg was short, right shoulder was high. Look at the right spinal erectors. This is something to look for in yourself as well. Most often, I find people who have had this issue have a really difficult time even getting in this position. Do your best, have a significant other or friend take a picture for you. This can be undone. But like I said, you have to make it a second job. You have the knowledge, you have the tools. Now find the time and be consistent. And that's the end of chapter 9. In chapter 10, we are going to talk about bulging, herniated, and degenerating discs. Thanks for being here.